Hello there. Thank you so much for being with us on this cold morning. I know wherever you are, more so if you're within the 5 divisions of Kampala, it must have rained. And of course, there is a saying that water is life. But depending on where you stay, to some people it's hard making it to work today because it rained. Others, they have challenges. They don't know where some of their property could be. But all in all, we say, thank the Lord you're alive today. And we thank Him for a country like Uganda, gifted by nature. It's raining, it has rained, the sun will be up soon and bright and shining. I'm Robert Chirabo Nyonyitono. This is The Extra, and this morning I'm going to be discussing something very important, a conference, but regarding matters of health. Have you ever heard of communicable diseases? What are communicable diseases? What are non-communicable diseases? Well, Uganda is going to be hosting the first annual conference on communicable and non-communicable diseases and the 19th Joint Scientific Health Conference. But I'm not alone in the studio to discuss this. I have Dr. Tuhaire Maureen, who is the Senior Medical Officer, Ministry of Health, with me in studios, and later on I expect to be joined by another guest still on the matter. Dr. Maureen, you're most welcome.
Thank you. Good morning, viewers, and good morning, people, this morning.
Now, I love understanding what we are going to discuss, but also ensuring that my viewer is well knowledgeable of what we are talking about. Now, here is a conference, but 2 words: communicable and non-communicable diseases.
Yeah.
Please, let's do the dictionary work first.
Okay, so the communicable diseases are illnesses that are caused by bacteria, caused by viruses, caused by all these different pathogens. And these can be from one person to another, but also from animals to human beings. So these are the diseases like malaria, tuberculosis, HIV/AIDS. So some of these other vaccinable diseases like polio and the rest. So when we talk about communicable diseases, we're talking about these infections that we usually get on a daily. But when we talk about non-communicable diseases, on the other hand, these are chronic illnesses. The chronic illnesses like the diabetes, the hypertension, the cancers that we are seeing, but also the mental health challenges that we are seeing currently rising up in the country. And as Ministry of Health, we've joined forces so that we're able to have this discussion in one space. And this is why the conference is happening this year. We are joining together with the 19th Joint Scientific Conference, Health Conference, which is usually hosted by Makerere University. So we're joining forces together, Ministry of Health and the academias from Makerere College of Health Sciences, and together we'll be able to host this conference. And this conference is on next week from the 3rd to the 7th of November, and this will be at Speak Resort, Munyonyo.
Now, Dr. Maureen, also help us understand why this conference, because Ministry of Health, you've held conferences.
Yeah.
Every time there is a conference and Ministry of Health, yes, of course, dealing with life, we expect. But why this conference? Why now? Because now these are 2 in 1.
Yeah.
We have the first annual conference on communicable and non-communicable diseases.
Sure.
Those you've defined very well. But then it's jointly running with the 19th Joint Scientific Health Conference. Why the merger? Why the conference now?
Yeah. So the conference is now because we are seeing a rising number in the non-communicable diseases. Currently, we know that malaria carries a brunt of over 12.4 million cases in Uganda alone, and tuberculosis about 30,000 cases that go undiagnosed within the country. About 1.43 million Ugandans are suffering the brunt of HIV/AIDS. And we have these non-communicable diseases contributing 35% of the mortalities, the deaths that we see in the country. So we've realized that for us, since our vision as Ministry of Health is really to offer a healthier health to the population, but this should be people-centered. And we are saying we want to treat a client as a whole and not as a collection of diseases. We are having a number of people come in at the facility, and 4 days down the road, they tell you they've run a stroke. And yet this patient was actually in the hospital, in the clinic for malaria, for a urinary tract infection, for, you know, and so we want to bring together the integration, and the theme for this conference is unified action against communicable and non-communicable diseases, so that we're able to hold hands together. Everyone has a piece that they play in this puzzle. And the joint scientific conference is mainly hosted by the academia. So these are the people that do the research. They study, understand why we're having rising numbers of diabetes in children, but also in adults, understand why we have hypertension, understand why malaria is still a challenge in the country. And at the end of the day, we wanted to merge and understand how does the science inform the policy, and how do these two work together to provide joint solutions so that we're able to have a shared responsibility, but at the end of the day, have everyone understand why we need to have these integrated actions. So we need to adapt, but also to adopt, and this is why we are having this conference at such a time. Yeah.
Now, when we talk about matters of health, I know the Ministry of Health is doing very much, the academia is doing very much, but let's look at the ordinary Ugandan. How interested are they when it comes to matters of their health, doctor? Here, researchers are going to give their findings. You're going to also look at the findings, draft way forward. But when it comes to the people to whom all this is done, your assessment?
Yeah. So we know that about 60% of our population seek care in the private sector. We know that we have the community with us, and this is where a number of us also seek care. But that individual health matters. And it's important that everyone is able to take a responsibility, but also demand for a service. If you come to the facility and you anticipate you're not feeling well, you should be able to demand for a test, but also when vitals are being taken, the blood pressure, so that you know and get interested. What is my blood pressure? Is this blood pressure within the normal range? When was the last time you did a blood sugar test? So it's important for us as individuals to be informed, to know, to have this with us, to guard ourselves with information. And once you get into the facility, you're able to demand for a service. So this is why we're bringing it out to the people, because we know that it's a shared responsibility. Health starts at home. Prevention starts with the people. So the people need to do the basics to prevent infection. I know that during even the pandemics, we've had COVID, we've had Mpox, we've had Ebola, and most of these come as a result of some zoonoses, so some infections that come in from animals to humans. But we know that the key is prevention. And what is that prevention? This is hand hygiene. Infection prevention and control starts with me. If I am able to pick on a cat or a dog, have I washed my hands before I do any other thing? Because we know that some infections from that could be passed on to the humans. So all this information, we are bringing it out to the people so that they're able to take responsibility for their actions, but also play a part in their health and see us move towards achieving our sustainable development goals. If we say to prevent malaria, you need to sleep under a mosquito net. We expect you as an individual to guard yourself with a net, sleep under the net every night so that you're able to protect yourself from getting a bite from a mosquito. If we're talking about tuberculosis and you've had someone in your household or you yourself that is coughing for more than 2 weeks, the expectation is that you have the information that if this has gone beyond 1-2 weeks, I should move to a health facility or in the community and identify a health practitioner that can be able to support me, but also refer me to the right spot. So this information is, we are putting this out there so that every individual is knowledgeable and is able to demand a service that they would need to improve their health. We can't do this alone. We can't do it as government. We can't do it. So that's why we're calling everyone, community, civil society, the private sector, researchers, all in the same room so that we're able to have this information out.
Now, you've talked about this conference and it's going to be happening now. One of the things I've noticed is we usually have conferences. We have speakers, researchers, both local and international. Yeah. But then the outcomes, is there a network that this information, these findings can trickle down? Because I think when you talk about, for example, non-communicable diseases, I think those include diabetes, hypertension, those cancers, diseases that cannot be passed by someone because of proximity or anything. Yeah. Now, doctor, here you find that maybe you've talked about a modern way of preventing such. But my grandfather in Kakuto, my grandfather in Kirufura has not gotten this information. Yeah. It remains within those that know. So what plans, or are there ways that the ministry, that, for example, the outcomes of this will trickle down to the ordinary person whose main purpose is why you are converging? Yeah.
So yes, there are efforts, and we have within the Ministry of Health different programs. We have the community health program within the Ministry of Health. We have the health promotion and disease prevention, and these are in charge of the community. And in the community, they are looking at the personnel that they can utilize in the community to pass on the information. We have the village health teams within the community. We have now the community health extension workers at the parish level. So we have at every level, we have a health personnel that has been given this information, that we continue to give this information so that they're able to hold community sensitizations, community dialogues, but also community outreaches where we can reach out and give this information to the people, have some testing that can be done, blood pressure monitoring. So we've been able to equip this. It's not everywhere in the country. It's a journey that we are taking on, and we believe that with that we're able to reach to that person down in the village, because they are within the village where there is a village health team that has been trained. At the parish level, we have the CHU, who is the community health extension worker. And these, we believe, will work with the community to be able to pass on the information, but also work with them on a day-to-day basis, even beyond just us at the national level. So much as we cascade this through the sub-national, at the district, local government, and then down to the sub-county, who are the health facilities. But we also have structures. And even the parish development model has the pillar 4, which is the social service pillar, that looks at the health matters. So we are utilizing and working together with the different entities and different parts of the government to be able to enhance this information reaching down, but also concentrating and knowing that health is a priority for them, and ensuring that my grandmother down there in the village is able to get this information and move to either the community for testing or move to the facility where they can receive the appropriate care.
Yeah, well said, doctor. But then statistics reveal that a number of diseases Ugandans are suffering from are preventable diseases.
Exactly.
Majority, about 90
yes.
plus of the diseases that Ugandans are suffering from are preventable diseases.
Yes.
How can we reverse this trend?
And that's why I said health is made at home. So the prevention is our is our key role as Ministry of Health. And the President has said this over and over again. Our first goal is really health promotion and disease prevention. And there are very many things that we can do without even money, that we can do, washing our hands with soap and having running water whenever you're able to touch anything. Because remember, the foods, most of these diseases that we get are from either utilizing poor hygiene at our homes, having a toilet. So just these hand washing facilities are a very key issue into enabling us prevent some of these diseases, but also clearing our bushes, near clearing the stagnant water where the mosquito breeds to cause the malaria, which is really the biggest contributor to communicable diseases in some parts of this country. So the prevention is what is very key, and that is what we put across. We need to make sure we prevent the illness, and that is what we are calling on to the public, to make sure they can prevent diseases in every way possible as we teach them on how to prevent the different diseases. If you know that you have someone that has tuberculosis that has been diagnosed, we isolate them for a certain period of time as they are getting treatment so that they are not infecting the other children or the other people in the homestead. So prevention is very key for us, and just having the hand washing facilities, having a toilet where you're able to properly dispose of your waste are very key important aspects for us as the Ministry of Health.
Well, hygiene is made at home. That is something you should really take very serious, because it doesn't make so much sense when a number of diseases that people suffer from can be prevented, and some or majority are diseases as a result of hygiene. I remember there was a time when jiggers were a problem in this country. The side of Eastern government, Jangwe to Yambe, people are talking of jiggers, which jiggers has sign of hygiene, I must say. Now, earlier on I told you that I'll be joined by Dr. Augustine Lubanga, who happens to be the National Medical Director of AHF Uganda Cares. Now, I'll be going for a break. When I return, he'll be joining me on set, and we'll be three, my guest and the other. Let's return shortly.
Thank you.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Following our earlier communication regarding the technical challenge that affected the transmission of some free-to-air television channels, Uganda Broadcasting Corporation UBC wishes to provide the public with an update on the ongoing restoration efforts. Our engineering and technical teams have been working diligently to resolve the issue and restore normal transmission. While substantial progress has been made, the process has taken longer than initially anticipated due to the complexity of the fault. We assure our valued viewers and partners that full restoration remains our top priority, and every necessary measure is being taken to ensure a stable and reliable signal across all affected platforms. In the meantime, we kindly advise viewers to rescan their TV sets to access the available channels. This will ensure that you can view the channels that are currently broadcasting without interruption. UBC sincerely apologizes for the inconvenience this disruption has caused and appreciates the continued patience and understanding of our audiences as we finalize the recovery process. Further updates will be provided through our official communication channels as progress continues. For additional information, please contact Public Relations Office, Uganda Broadcasting Corporation UBC. Email info@ubc.go.ug or +256 703 826 623.
Taxation is a bit complicated, and the only way to demystify it and make it as easy to understand and to comply with is through engagement. Is there a limit to the number of cars a returning citizen is bringing into Uganda? Who has paid the excise duty on this water is not the supermarket which has sold you this bottle at 1,000. It's not the business. It is the man who is going to drink this water. We strongly believe that it will only be through such constructive engagement that we'll be able to broaden our tax base and build our country together.
Buza Kamiso now. Now you can get direct answers. Send your tax-related questions via WhatsApp or SMS to 0790 141 887, and the Commissioner General of URA, John Musinguzi, will personally address them. Tune in to UBC News Tonight every Monday and Wednesday for expert insights and clear explanations. Boozer Commissioner.
Exercise can't be sustained. Eating can't be stopped. It's even harder to lose weight. Come and give it a try. Ginshikang L-carnitine chromium capsules. Plant extract, scientific ratio. Take 3 capsules each time. The active ingredient accelerates fat burning, eat twice a day, don't take a detour. Weight loss starts now. Ginshikang L-carnitine with chromium capsules helps you stay in shape. Please follow medical advice when taking this product. For more information, visit our website www.hgo.com or call 0800 335555.
Step into a world of excellence, comfort and pride with Royal Foam Furniture, crafted to perfection right here in Uganda. We bring you state-of-the-art living room furniture and bedding products at affordable prices. Our wide variety of mattresses include orthopedic, pillow top, spring mattresses suitable for institutions like hotels and many others for home comfort. With every piece telling a story of royal excellence, our products are built with the highest quality materials made to last. Experience royalty with Royal Foam Furniture, proudly made in Uganda, so buy Uganda and build Uganda. Visit our showrooms at Ginger Road, Chambogo Junction, Bukoto Chisasi Road, and on Victoria Mall, Entebbe, on the first floor.
When you want to relax your body and refresh your mind, welcome to Hotel La Confidential, Aroa's premier destination for luxury and comfort. The only hotel in Aroa City offering a serene atmosphere, breathtaking scenery. Come and discover our exclusive wellness club with packages that include a fully equipped gym, a rejuvenating sauna, steam bath, and a great sky blue swimming pool. For events, our state-of-art conference halls and versatile event spaces are perfect for hosting shows, wedding receptions, birthdays, and more. Come and enjoy our cinema hall and unisex saloon, all designed to meet your entertainment and grooming needs. Bring your family and let your kids splash around in our beautiful kids water park. We are located on Aroa Pakwachi Highway in the heart of Aroa City. Don't wait. Visit us on www.hotelconfidential.com or call us on 0761 688 181.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Thanks for keeping it with us. We're still discussing issues regarding health, and that is communicable and non-communicable diseases, but letting you know and inviting you for the first annual conference on communicable and non-communicable diseases and the 19th Joint Scientific Health Conference. And with me, just in case you've joined, I have Dr. Mutuhaire Maureen, who is the Senior Medical Officer, Ministry of Health, with me. And at the extreme end, we've just been joined by Dr. Augustine Rubanga. Now, he is the National Medical Director, AHF Uganda Cares. And I know, offset, I was telling him that Uganda Cares is one of those popular organizations that you hear people talk about in serious and unserious discussions as well. Jokingly, but because of the noble cause they do, that is looking after persons that are suffering from HIV. Now, Doctor, you're most welcome.
Thank you. Thank you.
And I'll just take it straight to you. Now, when we talk about the silent epidemics, that is the STIs. First, why are they called silent epidemics to begin with?
Yeah, thank you very much. We know that STIs, but also similar to other disease conditions like the NCDs, they will take some time before someone actually has complaints or what we call visible or felt signs and symptoms. So they will be in your body. And for instance, like syphilis, it may take years or sometimes even decades for someone to really know. And by the time they know, they have already sought care, which is not even related to the condition, and time is lost in the process. By the time we begin actually managing that client, treating them, it is very costly and things like that. So it's that nature that they progressively occur, but during that time, someone innocently can transmit these diseases, making the situation more worse and worse. So.
Okay, now having explained, let's look at the statistics burden for these diseases.
Yeah, looking globally, we know that every day that goes by, over 1 million new STI infections happen or occur worldwide. And what that actually means is that it is a silent driver of other infections like HIV. It also is a silent cause of unattended infertility, especially in the women. But we also know that in one or the other, it leads to other non-communicable complication that could be there. For instance, when you have hepatitis B and it is not detected early and treated, then you are likely to go into other conditions like non-communicable diseases, which are cancers in that way. So it is an increasing problem that we have, and looking particularly for Uganda, we see that the younger people are most affected, including the women. They carry most of this burden. And if we don't come out and address this jointly as you provide care for other conditions, then we are likely to have the situation worsening, but most importantly, care becoming more expensive, and then our population not served in a more effective and efficient way.
Yeah.
Yes.
And he talked about it being a driver for infertility and HIV/AIDS, but also the poor maternal and newborn outcomes as a result of, syphilis infection. We're seeing, abnormalities in children as a result of this. So it's very key that we're able to intervene in time, because some of these are contributors to the non-communicable despite being communicable. So the interplay continues to interface why we need to handle this together in the same room, in the same place.
Well, and that said, let's also look at the information that the public has regarding STIs, doctor, these silent epidemics. How aware is the public?
Yeah, I would say that, of course, with the time, as we've been implementing, for instance, vertical programs like that of HIV, there could be a lot of information about conditions like HIV, but not much attention has been given to sexually transmitted infections other than HIV. And the reason is that probably not much focus either by donors has been put there, but we know within the mainstream of Ministry of Health, there is that department tackling HIV, but these are underfunded areas, meaning that on the money which may or funds are available could be just to buy the medicine, and less could be available for public awareness and coming to TV or coming in a community awareness campaigns that may happen. Those that may not really be there. The other way has been that there have been opportunities to engage with the population, with the Ugandans, and we find that the way we've been providing care, coming on, and then we are talking only about, for instance, HIV, and leaving out the wellness services like those of STIs. There have been lost opportunities in that area. So we are trying to say that we should integrate at all levels, whether we are in programming, coming out to the communities to serve clients, and see a client or a Ugandan as a whole, not in domains of diseases in that way, which actually brings care in forms of silos or small packages that are packaged on. So Ugandans may not be that informed in some of these areas, especially when it comes to STI. And that's one of the reasons why the health-seeking behaviors actually still low. And we see that the most affected populations have not been that of our focus, the younger people, saying that these are safe. Maybe much of the focus has been on children and adults, especially the women. But you find that the young, the youth have been, adolescents have been left out. So we are on those campaigns to try to work with all partners, with all sectors, to try to see whether you are in education, you are in environment, that these are areas which you should address and talk about, so that we seize all opportunities and propagate or propel this information and it reaches the Ugandans wherever they are.
Well, we are still talking about issues of health, disease prevention, disease control, and also a conference that is coming up, that is the first annual conference on communicable and non-communicable diseases at the 19th Joint Scientific Health Conference. These are going to be at the Speak Resort Munyonyo. Yes. Now here I come back to Dr. Maureen. Dr. Maureen, having listened to what Dr. Augustine has just said, now let's go back to the conference. You said we are going to have the researchers, we are going to have the officials from Ministry of Health. Why is Omuntu Wabulijjo represented? So we're not only having the people from the academia from Makerere, we're not only having, even Bara University, we have epidemiologists from the Uganda National Institute of Public Health. We're also having the private sector, civil society. So the civil society is where our community lies, and these are also going to be part of the discussions. And we're having people from the subnational level, that is at the district, that have been part of these, most of these researches, but also findings at the programmatic level, but also the beneficiaries of this service. You and I are beneficiaries, people from the districts are beneficiaries, so all of us are going to be in the same room. It is not only a Ministry of Health program, it is an entire conference that we are going to have all these people, researchers, private sector, civil society, in the same room to have these discussions. And as Dr. Augustine mentioned earlier, we don't want to be treating malaria in one room and you're treating HIV in another, you're treating, diabetes in one and the other. And this unified action is not coming in as a slogan. No, it is beyond just survival. It is ensuring that our patients are able to survive and they're able to thrive, but also be transformed, so that we're able to see these services get to them. They are able to be reached. So we're going to pick a number of joint solutions together and understand what needs to be done where and how best can we tackle these increasing numbers of the communicable and non-communicable diseases in the country as at large. Dr. Augustine, attendance, take us through. Is it by invitation? If by invitation, what else? Because when you talk about a place like Speak Resort Munyonyo, Ugandans, we are good at turning up. Yes, please.
We would like to have each and everyone, but as we said, we would like to, this is multi-sectoral, and we would like to tap from each and every sector of person. So there have been those targeted invitations, trying to see that no one is left behind. when it comes to contributing to the solutions to the issue at hand. But everyone is welcome, and the participation can be at all levels, and the conference is beyond the conference room. It goes beyond that. So we would like this to be talked about at the districts. We would like this to be talked about in the community, and we would like each and every one of us, including the community, the Ugandan at the village level, to demand for this, to tune in. I know it will be, media will be there, and then listen to the news, what actually happened, and get that information and demand for the services as to be integrated, but also to accept the changes that they will be finding at the health facilities as they seek for these services. There are some changes that ministry has put in place. So being part of or a player to see that we implement and move forward.
They can also follow the conversations online through our Ministry of Health social handles, Twitter, so most of the people can actually be able to follow. Registration is still open until the 3rd of November, so anyone is welcome to register to attend, and they're different. So they can just get to the Ministry of Health website, get details on the registration, be able to register so that they attend the conference. But also follow us on different social media handles so that we're able to bring to them live details from the conference.
Sure. Now, Doctor, what do you anticipate, or what do you hope to achieve out of this conference?
Yeah, I would like, first of all, to consolidate this partnership of multi-sectoral, want all players, so that we agree and embrace this new direction of providing and looking at Ugandans holistically, but not in disease domains. The other thing is to, of course, seek, and we are calling for more funding towards this integrated kind of approach. So like those that provide the finances to really look into this. There are certain areas that are still underfunded and what. So like that to come up closely. But we also want to learn the new models. I know people will be presenting, and there are certain areas which we can take on and adopt and learn from others and so on. But we also want to hear from the implementers, the grassroots, what actually is happening, what experience have they had as they hit the road to start taking on this new direction of integrated service data. We would like to learn from those. But most importantly, is for the Ugandans to be aware of what is actually taking place, what new direction has government taken on, to try to see that we are served and they are served better.
Yeah, and I think in addition, just like he mentions, innovations, amidst these financial constraints and the migrant funds and resources that we have as a country, we are really looking at what can work best to provide a healthier and resilient service to the people out there. So really it's an opportunity for us to learn, but also to hear from those that have done it at the lower level, so that we are able to serve them better as a country, as the Ministry of Health, so that we keep our vision of a healthier, people-centered provider for that. So really it's a call to action, because we know that we can no longer go individually. We need to move together. A team that works together, or rather hands that hold each other, are able to move further than just each individual picking on a piece by themselves. So this is why it's important for us to have this. Yeah.
Definitely nothing regarding health is not important. But one of the things is that I've taken on is all the experts.
Yes.
Having a way that they are moving forward, doing things in tandem. Not saying, Dr. Augustine, for you, that side of HIV, STIs, then I have Dr. Maureen here, maybe for you, for little children. Then a psychiatrist is the other side.
Yeah.
So if they are saying, no, let's find ways how we can work together. And that brings me to the end of this show. But allow me, before saying final goodbye to you this morning, to give each of my guests a minute or two for their parting shot. And ladies first, definitely.
Thank you very much. It's been an honor to be here. Please, let's be a part of this conference. Join our conversations online next week, 3rd to 7th of November at Speak Resort Munyonyo, where we can be able to shape the change that we want to see and build a resilient system that is able to provide services even at that level. So keep healthy, make sure that we prevent, take the meals that are required. Nutrition is very key in this circle of health. It's a very big part of our prevention aspect. And yes, the call to action is all of us have a role to play in this. So let us go out there and do the best that we can with what we have.
All of us have a role to play in this. Well, very interesting. Doctor.
Yeah, again to thank the viewers for listening in, and but also following us, and then thank the other partners that have contributed to us having this conference actually jointly for the first time, but also to request each and every one of us to keep the promise. This time not only to prevent HIV, but also the other disease conditions. Let us embrace the early screening. Let us go to health facilities and seek out for these services. I think government has equipped the facilities more better than before. Go check your blood pressure. Go have your blood sugars checked. And as my colleague said, Dr. Maureen, nutrition is key. Have your BMI told to you and know where you are, where you stand. So if we take this holistically, but taking on condom use just to prevent STI, HIV, and then the plate, you are not condomizing the plate in what you are doing, then we may not win or achieve the healthy Uganda that we are looking for. Thank you very much.
Well, thank you, Dr. Maureen and Dr. Augustine. Thank you very much for your time. Fellow Ugandans, will be having the first national conference on communicable and uncommunicable diseases, but also the 19th Joint Scientific, that is, health conference. And like my guests have told you, if you're among those invited, please make sure to attend. Have the best of your day. May the good Lord bless you. See you tomorrow.
Amen.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Juko.
Yo.
Wachikuwa. Check the shopping, man. What's your secret?
Uganda wange. Haven't you heard of the parish development model, PDM?
Yes, I did, but I thought it was just a talk.
No, Sebatia. It is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a portrait project, and now things are moving.
Juko. I thought I was one of your friends.
You are.
But you left me behind.
I didn't leave you in poverty. What you do, just visit your LC2 chairperson and your parish chief and start the process of economic transformation. Just like that. The parish development model is an initiative from the government of Uganda through the Ministry of Local Government designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
In a nation hungry for truth, a world where every story matters, there exists a beacon of trust and reliability. For decades, they've been our voice and our window to the world, holding the mirror of our history. With 4 TV stations and 11 radio channels spanning 27 languages, they stand as guardians of information, defenders of truth. With Mascari Heritage Advantage, they uphold every citizen's right to reliable and free information. Their archive stories shaped our past and illuminate our present. Yet now, as new challenges arise and the world evolves, their mission faces its greatest test yet. Be part of our journey and let's navigate the unknown, uncover the untold, and safeguard our future together. Tune into your public broadcaster, for it is the intersection of trust and truth. Because to UBC, your story, and every voice matters. UBC, inspiring Uganda.
Following our earlier communication regarding the technical challenge that affected the transmission of some free-to-air television channels, Uganda Broadcasting Corporation UBC wishes to provide the public with an update on the ongoing restoration efforts. Our engineering and technical teams have been working diligently to resolve the issue and restore normal transmission. While substantial progress has been made, the process has taken longer than initially anticipated due to the complexity of the fault. We assure our valued viewers and partners that full restoration remains our top priority and every necessary measure is being taken to ensure a stable and reliable signal across all affected platforms. In the meantime, we kindly advise viewers to rescan their TV sets to access the available channels. This will ensure that you can view the channels that are currently broadcasting without interruption.